Good afternoon. I'm Dr. Libby Cope, the Health Officer for the Makah tribe, and this is the Health Officer update for the Makah COVID response on February 3rd, 2021. I'm going to share some slides and see how this works. Okay, so let me see if I can make this a little bit bigger. Okay, all right, so our current situation in Neah Bay has not changed. We still have 10 confirmed cases total. We have no current cases. In the past, we had 1 hospitalization. We've had 0 deaths, and we do not have anyone in isolation or quarantine. We've had no new cases since November 23rd. And phase 3, we are currently in phase 3 of the Makah COVID-19 public health protocols per Health Order 0121. Clallam County is still high risk. Their percent positive is 5.5%. The goal to not be high risk is 2%. So that's, it's been a while since they've been under 2%. They have 50 active cases and have had 941 total cases, 3 new cases in the last 24 hours. Unfortunately, 1 new death in the last 24 hours, bringing that to 5 total, and they have 1 current hospitalization. The data over the course of the pandemic that can be shown here in a graph. You can see the increase in the waves that we had in Clallam County at the end of the summer and again at the end of the year in 2020. There was another spike in Clallam County about mid to late January. It does appear that that is trending down, and we will just continue to watch how things go there in Clallam County. The state approach at this time has switched to regions. So on January 11th, the governor of Washington State, Jay Inslee, introduced the roadmap to recovery plan for safe starting, and that grouped all the counties into regions. Our region, or Clallam County's region, I should say, is paired with, includes Jefferson, Mason, and Kitsap County. And they are in phase 1. Last week, Puget Sound and the West region went to phase 2, which is based on them having improving numbers over here in these 4 categories, which are a trend in case rate, trend in hospital admission rate, percent ICU occupancy, and percent positivity. Now, this is interesting, and just an observation is that these metrics are now based on trends and improvement rather than hard numbers. And because Clallam County and the other counties that Clallam County is grouped with, there's not a lot of room for improvement. So that gives the region that they're in a little bit of a disadvantage. So it's possible that it might be a while before the Northwest region can move into phase 2. Just a quick reminder about transmission and disease activity. Asymptomatic transmission accounts for approximately 59% of all transmission. So some of those people who spread the virus without knowing it either go on to have symptoms or actually never even end up having symptoms. It's estimated that for each case, there are 5 unknown cases, and for this reason, masks and the physical distancing are all still very, very important. We're doing everything we can really to not overwhelm the hospital system because that's truly what leads to increased disease and death. Our COVID vaccine effort is well underway, and at this time, as I'm recording this, we are having another vaccine clinic at our community gym. As of yesterday, we had administered 742 total first vaccines and 54 second doses. These vaccine clinics will continue on Wednesdays and some Thursdays. They're from 9 to 4, but they are by appointment only. So certainly call the front desk 645-2233 to make that appointment. And I'll talk a little bit more about that on a slide that's coming up. This graph on the right, it's a little bit outdated. It's from January 25th, but we don't have new data yet. However, we are looking very closely at the number of residents that we've vaccinated. We're trying to achieve 70% of all the residents in Neah Bay to be vaccinated, and that gives us a measure of how meaningful it is in terms of the group immunity, or herd immunity is a common term, which just means the decreased likelihood of an outbreak happening here because enough people have been vaccinated. At this time, or as of January 25th, we'd had 616 residents and 74 non-residents. Those are Makahs who live off the reservation, or non-Makahs who work on the reservation. We are using the Moderna vaccine. This is a 2-dose vaccine that's 28 days apart. That 28 day is a minimum, so we need them to be at least 28 days apart, but you can actually go up to 6 weeks from that first dose to the second dose and still be just as effective. So it is okay if you don't get the vaccine, the second dose, exactly 4 weeks after the first dose. What you want to make sure you get it is within 6 weeks of that first dose. Protection from the virus starts 2 weeks after the second dose. And expected side effects when you get the vaccine is some soreness at the site of injection, aches and chills, and a lot of people have described it as a flu-like body ache. The second dose is exactly the same as the first dose, but because your body has already developed some amount of a response, reportedly the side effects may be stronger. Personally, I had no side effects except for soreness at the site of injection on the second dose, and I only had soreness on the first one. And the soreness was actually less on the second one. So I might have been on the fortunate end of those things, but I have heard of people who felt pretty sick on both. It's really just an individual case-by-case basis. We've been very fortunate to have 0 significant adverse reactions, and I'm actually going to say it's not a matter of fortune. It's actually pretty unlikely to have a significant adverse reaction. Of over 4 million people who've gotten Moderna, they only observed 10 cases of anaphylaxis, and this is from a study just from December to January of this year. All 10 of those cases were detected and treated and recovered, so no deaths associated with the Moderna vaccine. We do a screening at the beginning of our vaccine clinic just to see if there's any risk of any severe reaction, and I'll talk a little bit more about that. But we do a screening. We have people wait for 15 minutes to 30 minutes, and we have everything on hand. So we've got Benadryl and epinephrine and healthcare professionals trained to respond to anaphylaxis, which is that severe allergic reaction that we're looking for. So we are prepared for it, but we're not expecting it. But if it does happen, we are definitely prepared. So this is what I was going to share about. There's one contraindication to getting the COVID vaccine, and that is a previous allergic reaction to any of the ingredients of the vaccine. So what are the ingredients? This is cut and paste from the CDC website, so you can certainly look this up directly from the internet. These are the ingredients of the vaccine. So if you know that you've had, I think what's most important is that if you've had an anaphylactic reaction to a vaccine, which is a severe and immediate allergic reaction to a vaccine in the past, be sure to bring it up when you're doing the intake screening for the vaccine. Based on what you tell the intake person at the vaccine clinic, you might be asked to wait for 30 minutes, or you might actually be told that this is not a safe thing for you to get. But that hasn't happened so far, and we are, again, not experiencing any severe adverse reactions to this vaccine, which is great. This is a slide about vaccine eligibility. The tribe, and specifically STIC staff, several STIC staff have worked really hard to make sure that Makah tribal members have access to the vaccine. And because of that, we've been able to offer it to people ahead of people who are living elsewhere who are not Makah tribal members. And we did initially set up a tier system, but fortunately we can offer it to everyone in all of those tiers at this time. So if you want more information on this, I suggest going to the COVID website on our STIC website, or the COVID page on our STIC website. All of this information is posted there. But certainly any Makah anywhere can come here, and that includes descendants. So you do not have to be an enrolled tribal member. If you are a Makah descendant, call the clinic, make sure you're registered, get an appointment, and come in and get the vaccine. Again, we're currently vaccinating all tiers. So you do have to be a registered patient at STIC. You can go to the STIC website under patient resources and click the registration packet if you're not. If you've been seen here before, you most likely are a registered patient. If you are not a resident, you may access the reservation for a vaccine without a COVID test, just for getting the vaccine, but you have to have an appointment. So that's, again, all of our COVID vaccine clinics are by appointment. And it's very important that you have that appointment in order to get onto the reservation for the vaccine. If you want to stay and visit family, if you're a Makah person, you certainly have to have a COVID test, and we can work with you on that as well. But if you're just coming on for the vaccine, no need for a COVID test. The vaccine is still only for adults 18 and over. It's not authorized, and it's not a matter of the Makah tribe or our tier system or anything. It's simply not authorized for someone under 18 yet. Likely this fall after some more studies. I just want to clarify a little bit about what the vaccine does. It prevents the person who is vaccinated from death or serious illness. It might not prevent infection or transmission to others. And in fact, currently we say it does not prevent infection or transmission of the virus to others. So at this time, it only protects the person who gets the shot or who gets vaccinated. It does not protect anyone else. And I put an asterisk there because it might actually, and we'll find that out if it does or doesn't, but we just don't know yet. And that's why when you get the vaccine, you still have to have a test to cross the checkpoint, and why we still have to wear masks and socially distance. Again, someone who has had the vaccine can still get the virus and can still spread it to others. As a side note, the vaccine's not 100% effective. It's been shown to be 95% effective. So there is still a risk of actually getting severe illness. And that's another reason to wear a mask and continue to socially distance. The COVID virus variants have been in the news quite a bit lately, and there are three in particular that the science community is watching. These three come from the UK, South Africa, and Brazil. They have numbering systems that are not universal, so that's why you see those numbers on the top. Many people may know now B117, but a lot of people just call it the UK virus. That's just where it originated. The B117, or the one that originated in the UK, that was detected in the US in December. It's been detected in Washington State as of late January. That one we know is more contagious. Its transmissibility is higher. We don't know exactly how much higher, but it definitely is more contagious than the original, more widely circulating variant of the virus. It's not known yet if it's more deadly or causes more severe disease. So far, it seems to be, the vaccine seems to be effective against that variant, which is great news. The South Africa and the Brazil variants, those have arrived to the US for sure. They, as of last week, they were in a few states, notably with people who did not have travel history. So that means there is community spread. We don't have data on transmissibility, morbidity, or mortality, or the vaccine effectiveness. Certainly there is a concern because the mutations on these variants affect the spike protein, which is kind of the well-known picture of the COVID vaccine having the spikes. And that's what the current vaccines that we use basically use to attack or prevent the body from getting sick. So there is some concern that the vaccine may not be effective. What I am told is that this is not going to mean that the pandemic's not going to be over. We're still in the recovery phase, or projected to be in the recovery phase, but it will probably take longer because of these variants, which is certainly unfortunate. A few other things in the virus news. The CDC definition of a close contact may be changing. This makes sense. We know for sure that it can take less than 15 minutes for somebody to transmit the virus. It's just not as likely. And certainly it can happen at 6 feet. It's just not as likely. But they are observing that transmission in these situations is happening. And so they might be changing that definition. Other news, just as we're talking about some of the kids possibly returning to sports, if we have kids who have had COVID, depending on the severity of the disease, they do need to have at least a brief cardiovascular evaluation. This happens during sports physicals, so that will happen. If the disease was moderate, if they had a more severe case of COVID, then they should see a cardiologist. And this is stuff that our staff here at STIC are aware of and will catch during the sports physical process. Just a quick note on the health order. So we're in phase 3. This is enacted by Resolution 0121. The health orders are developed by the Makah EOC and then approved and submitted to the Makah Tribal Council for their approval. So the current phase 3 means that we can have outdoor gatherings of any size, indoor gatherings of 10 or less. And throughout all of these gatherings, you are instructed to avoid close contacts outside of household groups. So that means continuing physical distancing and wearing masks. Common questions that I get, now that we're in phase 3, can my friend so-and-so come and visit somebody who's non-Makah? And the answer is no, because or it depends, basically. The phase that we're in, it's not relevant to phase 3. So whatever phase we're in here is based on how things are going here in Neah Bay. So we could have a pretty awful outbreak somewhere else that somebody from here travels to, or somebody from there wants to visit here. And that's why our visiting and traveling protocols are different than any of the phases, and they stay the same. They stay the same no matter what phase we're in, and that will allow us to be in a good position, again, to respond to how things are going here in Neah Bay, even though things outside of Neah Bay might not be going as well. Another question that I often get is, can I get on the reservation without a COVID test now that I've had the vaccine? And the answer to that is no, because of that data I presented earlier, or that data that we don't have about the transmissibility of the virus. So somebody who's had the vaccine could still get the virus, become infected with it, and transmit it to other people here in Neah Bay. And that's the whole reason that we have the checkpoint and the visiting and traveling protocols, is to prevent that. If we start to see data that the vaccine does prevent that, that's when we'll start talking about, proof of vaccination as something that could allow somebody to come through the checkpoint without a COVID test. That may or may not happen. I don't know, but we just need more data. This is a reminder that during all phases, people in Neah Bay should maintain preparedness for shelter in place. So especially, making sure you have all the essentials so that you don't have to go shopping if we do have to go into shelter in place. Just something to keep in mind. And here's another reminder, our Hadassah team put together this flyer on Makah immune boosters. So we've got vaccine is just one tool, wearing masks is another tool. These are all things that are designed to help your whole body, mind, spirit. Your relationships are so important right now. And that's why we try to use the term physical distancing instead of social distancing. It's more important than ever to reach out to people and talk to your friends, talk to loved ones and family, and use the phone or have an outdoor safe get together where you're at least 6 feet apart. Please do that. I really encourage you to reach out and to not be afraid to communicate with the people that you love and to share that. It's a key component to being a healthy human. So that's it for this presentation. If you want more information, you can go to stic.org. If you have questions, please call 645-6273, leave a message, and we will get back to you. And if it's a frequent question, I will address it in these presentations. All right. Thank you. Please stay safe and sure.